Okay, I guess we are complete now. The team is here. I guess we can start that we are staying a little bit in our time frame. Welcome to our first online session for this year about health data and the secondary use of health data with the title, What kind of health data do we have? Do you know how much? You will see it later on. We have a great presentation about this. We want to give you today an understanding of health data types and their impact. So welcome to everyone, and we are very pleased that you join us today afternoon. Next slide. So we have that. We have a little table of content prepared for you. So we are in the middle of the welcome and introduction, the expert presentation on health data types, interactive questions, answers, and with live polls because we want to hear from you, and a little wrap up. My name is Birgit Bauer. I'm the moderator of today, and I'm the co-lead of Quantum Work Package 5.5. Please be aware, the meeting will be recorded, so you can find the recording afterwards. If you don't want to be seen, please turn down your screen now, and be aware that we will also make, and this is an announcement for the end of this session, we will make a picture of you, of course. So have that in mind, and feel free to show your faces today. We would love to see them. Okay, next slide. The purpose of the session for today is gain a deeper understanding of the different types of health data and why data quality is so critical for trust and sustainability and usability. Explore Quantum's role in improving health data labeling and its impact on healthcare and research. Understand the significance of EU regulations in ensuring secure, ethical, and effective use of data. And engage in an interactive discussion. As I mentioned already, your insights matter. So share your perspective through our live Menti poll so we can learn from you too. And this is very interesting also for us. So let's start. I think we have now first Menti question. So please, Yael, could you help us?
I will share my screen. Let me see.
This is one of our team members.
Works for you all. Yes. Can you see my screen now? You should be able to see my screen, and it's on the Mentimeter. Yes, so at the top of the screen, you can see the instructions for joining this Mentimeter together. So we will take a minute or two to do this. So if you go to menti.com and you use the code, so 29259815, you will see this first question appear on your screen. So we'll wait for a few of you to already do so. And this code, this Menti, you will use throughout the session, so you won't have to reconnect later on. And I see already some responses coming in that you see yourself on the screen as well. So I will give back the floor to Birgit to comment on the results on screen.
Yeah, it's interesting. The first answer was 100% yes. So I think we have an informed audience here. It's at the moment, it's a little bit going, 65% saying yes and 35% are not so informed. This is going down and a little bit higher. So please vote, because at the moment we are struggling between 60 and 70% for yes and 30 and 40% with no. So we have already, I would say, almost 40 votes. The yes is growing, the no is reducing now, it's coming down and more down. So we have 70 to 30. It's like in an online auction now. Give me your bid. Yeah, I think we can close it. Do we still have votes?
Perfect.
Yes.
We have a second question coming up.
Yes. Do you understand the difference between primary and secondary health data? Okay, we have a again, more yes. Some people need a little bit more clarity in that. And we have also some people saying, not really, maybe we need more information and communication about that. But your audience is pretty informed, I guess. Huh? I would say they are really cool. So we have 27 yes, they are fully understand. 20 say, we need a little bit more clarity. We have 3 no's, what is also absolutely fine, because that's why we are here, also to give you the information you need to understand more and have a better overview about the health data theme, what is huge. So I think that was the first round for now. Perfect. I would say a little feedback from here. We have lots of yes in every 2 questions, but I can see also the need of information and communication. And I would say, let's start with some information, right? So we need the slides again. Please feel free, if you have any questions, please add them into the chat for the moment. We will have a question answer session about after the speeches and after the information. But if you have in the meantime any questions, please let us know and do it in the chat. Let me give you a short introduction about the Quantum's focus on data quality and utility labeling. I think this is a little overview about that. And let's play some Lego. This is easy to explain to work with health data. When you have a big box with lots of Legos, you have different formats, you have a very chaotic structure. It's like a data lake coming together with a very unstructured in a very unstructured way. So you have forms, you have different formats, you have different colors, you have maybe some colors in a less number, in a smaller number, you have some colors in a higher number, and so on. So you have to sort it. And this is also what we have to do with data. We have to find out what data do we have. We can sort data also in, like the Legos, in colors or in formats, means maybe in women, in men. We can also sort in the disease areas, the different disease areas, and so on. And then we can arrange it. And this is also easy going, because if you have arranged it, you have a first structure in here. And you can also clean the data. When we talk about clean the data, we mean we sort out the bad data, the not helpful data. And this helps also to find a better structure for the data. When we present data visually, then you can think on infographics. Then we can see we have some percent, as we see in the Mentimeter. 50% said yes, 30% say no. And this is exactly the same. We can see how much data do we have from that area and that and that. This is what you see in the infographics and also in the diagrams when you are using maybe some social media for your research, or if you're researching in the World Wide Web or in a scientific magazine, you can see it there too. And at the end, here in my slide, we have a little house. So we have a story behind, and we can see how data, if we structure them, can work. We can find a story behind the data, and also we have an insight, we have perspectives, we can see tendencies, for example, for prevention when it comes to the use of secondary health data. And this is an important point. So what I want to tell you is we have to sort and we have to structure health data to find out what is behind the information. Can we have the next slide, please? And this is also how Quantum's built on. Quantum is a EU-funded project, and it builds on the TDAS. This is the joint venture to build the European Health Data Space, coming from the Sitra Foundation in Finland. And the EHDS 2 pilot, this is the European Health Data Space, what will come. And I think we have to, next week, we have a great day on the 26th of March, because then the law of the European Health Data Space starts. That means the EU countries have also to prepare themselves to be, I would say, connected within the EU for the European Health Data Space. And TDA, okay. Thank you. TDOS, yeah, I was a member at the TDOS 1 project, what was running out last year, and now we have the TDOS 2 project, what does a conceptual building blocks towards the health data at EU. And these concepts are set up in the European health data space in a real context. That means they design and the EHDS will be there and will use that concepts to be realized. Now the next slide, please. Now the next slide, you can see the consortium. Quantum has a consortium from 35 partners coming from 15 countries. I'm one of those members and I'm proud about that because it's always good to think innovative and have the space to work innovative. And this is what we are doing here. Those partners coming from health data access bodies, from data holders and data users. And the stakeholder community, what is included here is the health data at EU Forum, Projects Forum, and you guys, the Patients and Citizens Forum. And this is what we have here today in our great session. And also we have advisory board. Quantum has to deliver all those things we work on now in June 2026. So a little bit more than a year, we have time to develop our deliverables and set up a plans and give the recommendations to the European Union. The backbone of Quantum, I will keep that a little bit short because we have two exciting experts in the next session, and you will learn about this also a little bit more. We have a common concept for the data sets, quality and utility. That's important. There is also a common concept of the level of data holders' maturity. There's also a piloting and implementation of the label in Quantum data holders, means we develop the label, and in this phase it will be also implemented. The translation of the Quantum label into recommendations for a health data at EU is an important point. As I said, we have to deliver our recommendation next year in June. And then our last point is building capacity on the assessment of a data quality and data quality management for secondary purposes. Secondary health data, you will see them again in a few minutes. So this is what we are doing. And this graph tells you a little bit about the work we are doing. So we started on the left side. We brought up a consensus, then there was a little small-scale pilot done, and now we're on the violet narrow. There is an extended pilot in planning. My work in this is more to engage with you, the patients and the citizens, to explain what we are doing here. And now the next station, I can say, is the assessment tool, and then you can see down on the violet narrow, June 2026. And now we are going much more deeper in the primary and secondary health data. I would love to bring the stage to Professor Fidelia Castini. She is a professor in public health and digital health advisor of the Ministry of Health in Italy. She's also a chair of the steering board of the EHDS2 Community of Practice and co-leader of the dissemination and outreach work package in the Quantum project. So Fidelia, the stage is yours, and I'm excited to see your slides and listen to you. Thank you.
Thank you very much, Birgit, for your presentation and also for the previous explanation of the Quantum project. I hope to give you all an overview of the main aspects related to the European Health Data Space Regulation, and in particular the two pillars of the primary and secondary use. So the next one, please. As you can see, the European Health Data Space is a unique idea and a unique vision, but it contains inside the two main pillars, which are The first one that related to the use of health data for primary use. So it means to provide the best healthcare services to people, to the single person. And the secondary use, which is mainly related to other uses, reuses of health data which are collected on the primary site, but can be reused for many other purposes, which are perfectly declined into the regulation at the Article 53. So the European Health Data Space Regulation offers a legal base and also a framework for the governance of these two main pillars, and it is focused on aspects related to the infrastructures to support both primary and secondary use, but also on aspects regarding the capacity building which is needed at the member states level and also at the European Union level to support the functioning of these infrastructures and the development of this unique ecosystem. And one of these important aspects is related to the quality of data, because data needs to be findable, accessible, interoperable and reusable, but they need to be quality data if we want to trust in the information that these data are bringing. So the next one, please. And why are so important both the aspects and the pillars, the primary and the secondary uses? Because both of them have an effect on the patient's outcome. For sure, it is immediate to understand how important could be the primary use of data, the primary use of quality data for the provision of healthcare services and for an impact on the single patient. But if we think about, for instance, at the uses that we can have as a secondary uses, which are from this data for public health purposes, including those related to quality and safety of patients, and others related to the research, biomedical research development, and also others related to policy making focused on health planning and on health services, you can immediately understand how both of them, the primary and the secondary uses of data, have a relevant impact on patients' outcome. The next one, please. So, as I said before, we have a unique vision, we have a unique design, which is the European Health Data Space ecosystem, but we have two pillars. The primary use, which is based on the infrastructure My Health at EU, which is extremely important to connect the member states at the European level and to allow them an exchange of several categories of data, of health data. We are starting with 6 main categories of data, including a patient summary, including lab results and reports, including. So,
sorry, Fidelia.
Just regarding the infrastructure. So I was saying that we have these two main infrastructures. The first one, which is related to the primary use, to connect the member states for the exchange of priority categories of health data, as for instance the patient summary, the electronic prescription and dispensations, the imaging, both the images in themselves and the reports, and laboratory results, and also the discharge letters. But we have another infrastructures included into the EHDS ecosystem, which is related only to the secondary uses of health data, which is the health data at EU infrastructures, which has the same goal of the primary, which is the connection of all the member states at the European Union level, even if the kind of exchanges and the kind of activities and functioning are different, because it is an infrastructure which is focused on the connection of health data access bodies to allow the accessibilities and the usability of health data in all the member states, and also to facilitate this kind of exchanges for several uses included in the Article 53 of the regulation. The next one, please. So in details, if you look at the primary use, and especially what are the rights of natural person in using these services related to primary use, you can see that the natural person can have access to health data and for sure download a copy of this data, but also natural person can insert restrictions in the use or in the visibility of these data, and also has the right to opt out from data sharing, just in case if this person consider that some part of these health data, these personal data, are not he or she doesn't want that professionals or people involved in providing healthcare services are entitled to see this kind of data. But another activity which is very important for the natural person in using primary services of the EHDS is related to the insertion of information. So the patient with the European Health Data Space Regulation can add useful information within the system, within the electronic health records, to enrich the information and the details which can be used for providing the best healthcare services. And also the patient can can ask for rectification of information which are reported in the electronic health records. So these kind of activities and also the opportunity to exercise these kind of rights is based on a common European electronic health record exchange format, because all the documents, all the health data which are used for the primary use needs to be based on these common exchange formats to allow the connection and the exchange between member states. The next one, please. On the other side, if we think about the secondary use, and if we focused our attention on the other pillar, so the other infrastructure, which is health data ATU and other purposes, you can see that this secondary use is focused on a broader view, because this is not focused on the healthcare provision of services to the single person, to the single patient, but it is focused on all the population, all the applications involving a large number of people, involving the collectivity. And the most important purposes, which are mainly up to public sector bodies, are those involving the areas of public and occupational health, such for instance, the threats related to public health as emergencies, public health emergencies, as we had in the recent past COVID-19 emergency. But it is not limited to this, because we can use and reuse the data through the EHDS framework for secondary uses, also for policy making and regulatory activities to support the improvement of health planning and of investment of health resources into the right direction for the public interest. And also statistics and activities of data collection, which are useful for official statistics that can be support studies and research that are useful for the community. We have other purposes that are admitted by the European Health Data Space Regulation and that are useful for the public in the public interest, which are related, for instance, to the education activities and for scientific research, which is very important for patients and for patients associations, but also for the community in general. And through the European Health Data Space Regulation, we will have an acceleration into the related to the activities of scientific research, because this is included into the secondary purposes, and also according to the EHDS regulation, we could have a simplification, a facilitation into using health data for this kind of purposes. For instance, we don't need to ask a consent to the single person to proceed with the use and reuse of health data for research, even if we have to ensure the security and the protection of the privacy through the system which is included in the European Health Data Space Framework, through the use of secure processing environments and through the control and under the control of public health authority. The next one, please. So at the end, there are several benefits also if we think about the secondary use of health data, because even if when we think about the primary use and the benefit that directly the patient can have into receiving the best care, also through these exchanges and this mechanism to facilitate the exchange through the member states. For instance, imagine if one person is living abroad or is working abroad, that can receive the best care and can exchange his own clinical history with the country of origin. But we also will have a lot of benefits related to the secondary use of health data. And you can see that there are different actors that can benefit from these. For instance, if we think about regulators and policymakers, the European Health Data Space Regulation and the framework of the European Health Data Space will allow an easier access to health data and the larger health databases that are useful for providing better policy-making activities. If you think about the researchers could access, can access to a larger quality data set, and they have the possibility through the infrastructures to discover large amount of data and to use this data coming from different member states around Europe. And if you think industry and innovators, again, they can use this large amount of data and quality data from all the European member states to improve their discoveries, to use this data for innovations and to open new opportunities for the data economy. But mainly the patients. Why the patient is the most important target people for this innovation, because it will be possible with the use of the European Health Data Space Regulation and all the ecosystem of the European Health Data Space, including the secondary use. It will be possible to better understand the illnesses, the history of the illnesses, the origin of the illnesses, and also the mechanisms which are the base of the illnesses developed. And also it will be possible to test and to introduce new treatments and to advance more quickly with research, scientific research, biomedical research, especially the research which is for the future, the personalized medicine that can benefit a lot from a large amount of data. And also it will be possible for the patient to be sure that all this data, all the personal data will be anonymized or pseudonymized, and especially the use of this data, will happen inside the secure processing environment, which are based on specific requirements and then which are under the control of health data access bodies, which will be the public authorities putting this data safely and security. So the next one. And at the end, I would like to tell you that regarding the secondary use of data and regarding the new purposes that the European Health Data Space is going to introduce for the benefit of the European Union and the health policies, I am going to publish an open access book, which is free and downloadable from the Springer site, where you can find an overview of all possible categories of data and purposes which are mentioned in the EHDS regulation, and also the perspectives which will be useful for a public health development of the secondary uses of health data. And that's it from my side. Thank you very much for your attention.
Thank you, dear Fidelia, for this very interesting speech. And wow, lots of knowledge, I would say. And I can say that we have some first questions and also some first thoughts in our chat. We will answer them. And Barthélemy, what is your need?
Yeah, I would just say to Regina that Beatrice will share the screen when she will be presenting, because she has animation in her slides. So just for you to know.
Okay.
But maybe you want to reply to some questions already, or we keep this for later, Birgit, I don't know.
So we had, so we can have a short overview. We have from Noka. I'm sorry if I pronounced the name not correctly, so please correct me, but there was a question about, as a researcher, how can I access / contact EHDA for data access? And is there any data access request link, research and proposal channel? Steffi had answered from HDA. Within the EHDS, there will be HDABS established. There will be the orchestrator and national contact point for all data requests. So in Germany, I can say it, I'm German, we have a special center for this. It's under construction at the moment. They don't have don't have all data in place, but this will, I would say, change during the development of the EHDS thing. So Fidelia, do you have anything to add for this? Or
maybe just a word I can just say about Steffi's comment that HDAB means Health Data Access Body. So this will be national bodies established within the EHDS framework. Just a small precision.
Thank you.
Yes, I try to give flash answers because it is too long to explain all the functioning of the secondary use of health data and the structure. However, regarding the HDAB, which is Health Data Access Bodies, as Barthélemy said, there is a specific framework which is based on the regulation, but all the member states are working to align and create a common framework for all the tasks that the HDABs have to implement at the national level. And it will, when a researcher will be interested into finding and using this data, there is a journey to follow. So the researcher will ask the HDAB to the access of this data through an application. And how can researcher understand where are these data. This data will be available at, on the website through a metadata catalog, where all the available data sets around Europe are described not only regarding the contents, but also the geographical position of these data. So when a researcher will apply for an access, the researcher should send an application to the EHDS at the national level. The national level EHDS is in connection with the other European EHDS and can collect the data sets which are of interest of the researcher to allow the processing of these data sets within the secure processing environment, which is available in all the EHDS. And this is the most simple process that I can describe. We can have also other subjects that can support the health data access bodies into these activities. So for instance, trusted data holders that can have inside also secure processing environment and that can support the EHDS into providing this data in a safe way and in a secure environment. But the most simple process is this. So the researcher apply for an access at the EHDS level, at the national level, or also if the data sets are available in another country, EU country, the researcher can apply in for the EHDS at this at the other level, I mean the other country. But after this application, the EHDS will evaluate this application and issue a permit for the access. If all the requirements are satisfied, through the permit, the researcher can access this data within the secure processing environment. And this will be the way to support both the activity for allowing data uses and on the other side to protect people rights and protection of data.
Okay, thank you very much for this answer. It's not always easy, but you have to follow the pathways, and I think then data will be available. I see a lot of activities in our chat, but I want to come now back to Beatriz Barros. She will tell us and give us some information about the Article 51. That's key reflections. Beatriz is a scientist in the Innovation of Health Information System unit in Cienzano. This is the Federal Research Institute of Public Health. She is specialized in digital health, data science, and also health technology innovation. And she is the co-leader of, you heard it already, the TEDAS2 project, the work package 5 on data discovery, developing technical specifications and for data description, and national metadata catalogs under the EHDS for secondary use. Beatriz, the stage is yours. We are collecting the next questions, and after your speech, we are running a bit out of time, but I think we will have some new things, and we have also some minty questions for you. So Beatriz, I'm looking forward to your presentation. Thank you.
Thank you so much for the invitation and for the great introduction that we have been having so far. I indeed see a lot of questions. I can perhaps suggest that we collect the questions and then afterwards we can answer and provide more clarifications, because 1 hour is very limited for the amount of questions that we have, but we could definitely do it. Regarding my presentation today, well, we already had a very good introduction to the EHDS and secondary use. So I would like to take the audience through the question of which data are we talking about when we discuss secondary use of health data. And the answer to that lies in this Article 51 of the EHDS regulation, which lists the categories of health data that data holders need to make available for secondary use. And if we look straight into the Article 51 content, you will see this exact list And while it is quite detailed, some of the categories, such as other health data from medical devices or data on pathogens, raise further questions, because what specific data does this include? Which pathogens are to be covered? And this is a common question that have been arriving. We see the need to clarify these definitions, and we have been working on that close with experts in the other project, EHDS2, that was already mentioned. And through dedicated workshops, we have been exploring each category in depth, with the goal to provide a more clear description and concrete examples to explain this category. So based on this work that we have been doing, I will walk you through the different groups of categories that we have described in this article that can be used for secondary purposes under the EHDS. So the first category of data is administrative health data. This includes information recorded by healthcare providers, usually for administrative purposes, such as dispensations, claims, reimbursement data, and it also covers data related to the broader healthcare system, often used, for instance, for healthcare planning, policy making, resources allocation. So this is data that is typically in the ministries of health, public health agencies, national statistical institutes, and is aggregated in this group. It also includes, written in the regulation, data on healthcare professionals that are providing treatment. So professional status, specialization, affiliations, this is also included in the categories. Then we have data on registries and research data. So this includes data from health registries that are usually in national public health institutes and are used for epidemiology, public health surveillance, and disease prevention, for instance. This group also includes mortality registries, which contain data related to mortality. And additional, this category also covers research data. So the data that we find in research and academic institutes and universities, which is collected specifically to answer research questions and produce original findings. So usually this data comes from surveys, experiments, or observational studies, for instance. Then we have the data on electronic health records, the data that we think of when we think about electronic health data. This includes medical history, the diagnosis, test results, prescriptions, which of all are processed for the purpose of providing healthcare in primary use. And it also includes data collected in the context of clinical studies, clinical trials, clinical investigations that we found, for instance, in pharmaceutical and medical research institutions, which are usually used to evaluate new treatments or interventions on medical procedures. Another group of data is biobank data. So biobanks store these samples of different types of samples to provide answers to different studies and help researchers understand how genes and environment and lifestyle can help a person. So biobank data includes general information on the samples that are stored in the biobank, and also the data obtained through the analysis of these samples. So this includes, for instance, sociodemographic data such as age and gender, but also genomic data, epigenomic data, and clinical data from surveys or follow-ups. So we usually find this data not only in national biobanks, but also we have great established European research infrastructure such as BBMRI, and we have also academic and research infrastructures and pharmaceutical companies that conduct this type of genomic search. Then we have social, economic, environmental, and behavioral determinants. This data does not constitute health data, but can provide really useful context for health studies, diagnosis, population stratification. So this is also included in the categories for secondary use. These include social economic determinants related to the social and economic backgrounds, for instance, such as income, education, marital status. There is also sometimes encountered in National Statistical Office, environmental agencies. Then we also have environmental determinants that refer to the external factors that affect individuals in their daily lives, such as air quality, mobility conditions. And also in this group, we have behavioral determinants that capture lifestyle choices that impact health. So diet, alcohol consumption, drug use that are usually in databases of public health research centers, for instance. Then we have a category of data that generates a lot of discussion, and a significant portion of health data for secondary use is fitted in this category. This includes data that is automatically generated by medical device. So for instance, implants, diagnostic machines, monitoring instruments, such as the glucose monitoring or electrocardiogram devices, but also data that is collected from devices not automatically generated. So here we are talking, for instance, about imaging scans or test results. Then we also have in this category data from wellness applications. And this is data that is collected through mobile apps or wearable technologies that we nowadays use so much. And this data provides these insights into the individual's health, behavior, lifestyle, and this includes data in these applications and wearables that is shared with the manufacturer. And another crucial element here that is also included is data from registries from medicinal products and medical devices. So for instance, data that we have in regulatory agencies and device registries that document and systematically track the use of these devices, the safety, the effectiveness, performance. So this data should also be made available for secondary use. And then final category, genomic, molecular, and pathogen data. This data is usually collected in genomic research centers, for instance, for epidemiology search, diagnosis, public health surveillance. These include pathogens data like bacteria, viruses, other microbes that affect human health. This also includes pathogen epidemiology, environmental data, which provide insights into the presence and transmission of risk of pathogens in different environments. And this category also covers genetic and molecular data that is usually encountered in academic institutions, for instance. That includes information on human genetic material, modifications in gene expression, for instance, in response to environmental factors. So this is one of the type of data that is also included. And then it also includes the general broad world of multiomics data, which integrates various molecular analysis, genomics, microbiotics to study complex biological processes and their impact in human health. So all this makes this group of genomic, molecular, and pathogen data. And that brings us to the end of the categories for health data for secondary use. It is a lot of data. It's also important to mention that Article 51 of the regulation also allows member states to extend the scope of this electronic health data available for secondary use through national legislation and to establish rules, for instance, on how to deal with the correction or annotations on the data. Also, that national law may implement stricter measures and additional safeguards may be introduced here for certain categories, such as, for instance, genomic, endomic data, data from biobanks, and data from wellness applications. So these categories that I just present establish this basis that is written in the EHDS regulation, but more information on a national level will be implemented in these regards. And this concludes the information that I wanted to transmit on the health categories. I would like to give you one final thoughts on the challenges and opportunities, because we have talked through a lot of data, but it's important to remember, because this is a common misconception, that the secondary use is about reusing existing data. So this data is already being collected and stored. The challenge is to create these conditions for reuse and ensuring that those beyond the initial data collectors can access and reuse it to really unlock this full potential that data has, and by doing so that we can drive these benefits of better research, improved healthcare, stronger policies. And this is both the promise and the challenge of the EHDS, because to make this work, we need something that we have already heard today and is very central in the discussions on the EHDS, that is to make data fair. And by fair, we mean for data to be, first of all, findable. So data holders must describe the data that they have, and this should be accessible. And that is why in the EHDS, one of the capabilities to develop is the national catalogs. Then data needs to be accessible. Currently, one of the biggest challenges in health data research is the access itself. Every organization has its own procedures. There are a lot of barriers that make it difficult to navigate this system, and researchers often face multiple blockers, from unclear requirements to a very complicated approval process, and even difficulty in reaching the right data holders to answer the research question. So there needs to be this central platform that we have been discussing previously for requesting data, a national contact point to guide the users, and a well-defined and, most importantly, transparent process for access to data. Then interoperability, another big word in the EHDS discussions. Data is coming from different sources, but we need to be able to compare it, to combine it, so we can extract meaningful insights. And for that, we need data to speak this common language, and this is also big challenges. And finally, to be reusable, data to be well organized, structured, allowing for different groups to use it for a variety of questions. And most importantly, none of this is possible without high quality data. That is why the work on Quantum, for instance, is so important, because we need these metrics to define and understand the quality and utility of the data, so that we can also produce high quality and trustable results. And all this needs to happen in a secure and trusty environment, so that we ensure that the privacy is protected, while also making the most of this valuable resource that we have in health data, to be able to really bring these benefits to citizens and for all society. That's it from my side. Thank you.
Thank you very much for that great insights. It was really interesting also to see the articles and also to know more about Article 51, because this is one of, I would say, one of the most important things we have here in that game. What I decided is, and I asked y'all in the chat already, I think we quit our Menti questions and take care about the questions you had in the chat. I think that's most important. And we have some questions. Thank you, Fidelia, for answering some already. That's really helpful. And we have other questions here, and I'm looking for this. So we had some comments from the island, from Anne. Yeah. In Ireland, different hospitals have different systems that do not communicate with each other. So how is it going to be overcome? We had an answer from Jana. Open EHR would help in this area. Was actually curious if it may come up today in the terms of interoperability. I would say that's important. Interoperability will rule the member states and connect the hospitals and all the other stakeholders. Then we had, Jeremy Holt said also there is very little electronic data in the Irish health sector, all paper. I would say Ireland has a lot to do in that way. Paola said, what is the role of clinical registries and databases that might already have a data access mechanism to provide access to data for secondary use? Will they have to change their processes to comply with EHDS? Please, a short answer, because there was one question I would love to hear your answers to. Who wants to answer?
I maybe can give a short question, because this is related to the work that we are also doing in TEDS, because we are creating these technical specifications and guidelines for the implementation of the EHDS. And this is one of the topics that we are covering in the task of stakeholder engagement. And here stakeholders are the authorized participants, but also these research infrastructures that have already data and application processes and a way to work around the services that they offer. So we need to understand what is the role of these research infrastructures in the EHDS, and we will explore that through stakeholder engagement activities. So stay tuned also in the activities of TEDS, because we will create workshops and activities and explore these the best way that we can to provide guidelines on that sense.
Okay, thank you very much. Another question is Cleona O'Donovan. Said, are clinical audit data collections considered registries?
My short answer here would be, I don't know. We have been having a lot of these discussions, because we are always receiving, is this example included? And what I can tell is that the exercise we all do is that we have to go back to the regulation, understand what is the group, and discuss sometimes the legislative intent behind these definitions, and that is why they are so challenging, and we need presentations like this to really dissecate these examples. But I can see if this is included in our examples and go back to that question.
Okay, then we have also, and this is something I hear very often also in my work, about privacy and protection of privacy of people. How is the citizen right to privacy protected when all this data will be available? I would say we have GDPR in place. But do we have some other things? And I know the countries, so especially Germany, has another law established to protect health data more, so to make sure that people are safe and people's data are secure. But do we have other things in place for this? Because I would say, yes, they are protected, but correct?
Yes, the EHDS regulation really focuses a lot on data privacy, and maybe we should have a follow-up session only on privacy because this is a very big concern, understandable, but there are a lot of work to be done. We have the processes to protect information on the data, then we have the security infrastructure that is being constructed for researchers to analyze the data in a very controlled and private setting with a lot of security measures, and we could really dissecate into that. But the short answer here would be there are a lot of concern in the EHDS regulation regarding privacy, but also in the implementation. We are, for instance, in TEDS, constantly discussing this need for really putting high barriers in terms of risk, in terms of security in the analysis of the data and the access of the data. This is filled in different areas. We have the way that a researcher can apply for the data. That is also, they have a lot of criteria for it to be secure, to assure that the data is being used correctly, and also in the access and analysis of the data. So I would say maybe challenge a follow-up session on security, because we can really go through all of these steps in the EHDS regulation that are supporting this matter.
That's well noted, Beatrice. I will do it on my list. We will see what we are doing in the second half of the year. So now, time is running a bit out. So we started 5 minutes late. So I will take those 5 minutes now. We have a picture time. So we want to create a photo with you. So give us your smile for today and say hello to the world. And I think, Yael, you're doing the photo now?
Barthélemy will do the photo. If Regina can stop sharing her slides, then we can have everyone on a screen for a second. Here we go. And if you want to turn on your cameras, and then
community, it's the first time I see you all.
So not sure if I can get everybody, but at least I will hide participants without video.
Great.
I have this option, so I already see many smiles.
Okay.
So
great. I think we have some announcements. So do we have the perfect picture?
I will do another shot.
Okay.
In 3 seconds, please. You.
Great. Wonderful.
And then we can put back the last slide of the slide deck.
Yes, we have some announcements for you. So because, of course, this is not the final version of the sessions, we have a row of sessions. And I would say this session was really engaging. Maybe we have to go back with the teams thinking about another half hour for this session, not 60, 90 minutes. I don't know. We have to talk about it. I have well noted the privacy issue on my list for next sessions, but we have on May 6th at 2 o'clock, and we found out that we have a system here, and it's always a Tuesday, it's always 2. We have the next session with the theme, Why Should I Care? The Benefits of Health Data Label for Patients and Citizens. The invitations will be sent out very soon. Also, the recording of the video will be shared with you, and also you will receive some other things. And meanwhile, you can reach out to us. We have also some nice, lovely QR codes. We have a website in place, of course. You can subscribe to our newsletter or join our network. We also have a channel on LinkedIn. You can follow us, and also on X, formerly known as Twitter. I think that's it. Do we have another slide? No, it's the thank you slide, right? Yes. So if you have some questions or following up thoughts, you can contact us on info@quantumproject.eu, or as I said, we have the website, also our channels. I can say thank you from my side for your active participations. I learned a lot from you all today. Thank you to our great speakers, Fidelia and Beatrice. Thank you for your presentations and your thoughts, and also helping us to answer the question. Thank you to the team, Yael, Barthélemy, and also Regina, for the great help in preparing that session. And now it's on me to say thank you to you all, to be there, to be active, and be interested in this most important theme. I wish you a great afternoon now. Grab a cup of coffee, maybe reflect on that session, and let us know if you have anything to say or questions or whatever.